asked us to have a look at. And it's really opportune, I would say, because it's talking about anxiety and stress. We're living in difficult times, really, with this pandemic that everybody thought at the beginning 2 years ago that it would arrive and would disappear. Do you remember who said that? Would disappear. However, it hasn't disappeared. We also felt that the vaccines would give us a way out. And although they have reduced the number of deaths we've had and the number of people on ventilators, COVID is still here, and it does cause a lot of anxiety and stress. Coupled with that, we also have our own anxiety and stressors of just living, working, going about the things that we have to do. And with the overlay of that, the pandemic, people's jobs sometimes at risk, we now have the added complication of those of us who work in healthcare having to support colleagues who are having to make that decision about having the vaccine, because the rules are that from 1st of April, if you haven't been vaccinated, you'll lose your job. So there are so many stresses that we're living with. So I'm delighted to welcome somebody who, if you've joined us regularly over the last 18 months, you will know well. Dr. Joseph Omofuma is a GP, and he is an excellent speaker. So Joseph, welcome. And I'm looking forward to what you have to say this morning on anxiety and stress.
Thank you very much, Ngozi, for your kind words. Good morning, everyone. It's nice to join you again. I'm glad to be here, and Happy New Year to those of us who I haven't seen or we haven't met. So like Ngozi said, my name is Joseph, Osage Joseph Omofuma. I am a GP in Rochdale. I have been a doctor for 22 odd years, and one of my special interests is mental health. Okay, so yeah, and like she said, I joined Ngozi and several other esteemed colleagues in supporting the work that CAHN does, and so we believe in what CAHN is doing, and so we help in supporting the community in whichever way we can. So I understand this topic was requested after a very fruitful discussion last week, which sadly I missed, but I'll try and catch up with it on the internet. Okay, so today, let me just put it up front that this is a huge topic that we are going to try to tackle. So I'm not going to, by any stretch of the imagination, going to try to deal with everything. What I will try to do is to give us snippets, snapshots, and sort of tidbits that we can take home, things that are digestible, things that we can use on a day-to-day basis, if that's okay. And hopefully, if we then have questions, we can then look into things in closer detail. All right. So let me see if I can share my slides with you. Fantastic. Okay, just bear with me. Let me work out my technology here. So if you haven't been joining us before, this is a regular thing that we do here at CAHN. We have these health talks in order to educate the community, and so I'm not going to be speaking at the level of like I'm talking to health professionals. So I want to try to bring the information closer home, so that hopefully we can glean some things from there. All right, so fantastic. So before I do that, let me just put this into, right, so this is what we're going to be talking about. I want you to see my slides so that we can just, you know, get a better understanding of how we're moving along. Let's start with a few definitions, because I think it's really important to go back to basics. Mental health is actually, well, this is one of my favorite definitions of mental health. It's a state of well-being in which an individual realizes his or her true potential and is able to cope with the normal stresses of life, work, and productively make contributions to society. a state of well-being in which an individual realizes their true potential and they're able to cope with the normal stresses of life, work, and productively make contributions to society. Like Ngozi rightly pointed out, we're living in very, very strange and difficult times where, you know, there's coronavirus pandemic, people are losing their jobs, businesses are facing a lot of difficulty. Apart from the normal stress of everyday living, we're now having added stress of the pandemic as well. So it really is not, it's not great. So I will sort of jump into some more definitions. So anxiety is basically defined as a feeling of unease, such as worry, fear, or foreboding. A feeling of unease, such as, you know, it's basically the disorder of fear, because one of the things you've asked me to talk about is to distinguish between anxiety and stress. So I will switch intermittently between the two so that we can understand how these things interrelate with each other. So anxiety is basically a disorder of fear. It's an anticipation that something bad will happen to us. So it's a feeling of unease. Anxiety can lead to depression, and it's also one of the main symptoms in other anxiety disorders, such as panic disorders, post-traumatic stress disorders, phobias, and things like that, which we'll be looking into later on. Now, let me just quickly point out that having anxiety is not the same as having an anxiety disorder. Let's just be clear with that, because as human beings, at some point in your life, in my life, there will be some form of anxiety. All right. So that's not what we're talking about. If you're feeling anxious about something, in my case, when Man United is playing, I'm anxious. I don't know which team is going to come out. So that's not what we're talking about. Anxiety disorder is a disorder that is usually characterized by persistence of symptoms, usually for more than 6 months. All right. So the symptoms have to have been persisting. And those symptoms are capable of disrupting everyday functions. In other words, it affects how you live your life and the choices that you make of your life. I think that distinction is really, really important, because having anxiety for a few weeks, a couple of days, that doesn't mean you're suffering from an anxiety disorder. That probably means you're human. Okay, but an anxiety disorder, you see, I'll also say this as well. One of the things that a lot of my colleagues sort of agree with, anxiety is very difficult to diagnose sometimes, because anxiety cuts across several aspects of the mental health spectrum. Several different things manifest in form of anxiety. There's anxiety in depression, there's anxiety in schizophrenia, there's anxiety there's lots of different areas where anxiety manifests. So sometimes people just generally have anxiety, and it's difficult to actually pinpoint, is this anxiety or is this something else? I'll try to talk about, sorry, someone is talking there. I'll try to
when I came home yesterday, the room was tidy.
I'll try to narrow my discussion today to something called generalized anxiety disorder, if that's okay. But like I said, we'll look at a few things. I'm going to look at this with broad strokes initially, and then we can sort of move on and see how we can get. Now, stress, on the other hand, in terms of definition, is a physical, mental, or emotional factor that causes bodily or mental tension. Physical, mental, or emotional factor that causes bodily or mental tension. Now, it can be external. Stress can be from outside. Stress can be from inside. It can be acute. In other words, something that happens quite recently, like a relationship breakdown, this pandemic that's going on, failed driving tests, you lost your job, just maybe you got a quick notice, something like that. You lose money, but it could also be chronic. All right. In terms of chronicity, if it begins to last more than 6 weeks, generally, that would be considered to be chronic. Okay. So in terms of relationship abuse, physical abuse, bullying in the office or bullying in schools, financial struggles, if they last that long, racial discrimination has been found to be a huge stress factor, which is One of the discussions we've had in the past actually about the fact that people of color, when you are regularly discriminated against, it builds up. And then it causes some form of stress. All right. So it's really important to identify that this is something that usually comes from outside, but it can also come from inside. So in terms of internal stresses, unrealistic expectations. Sometimes some parents put unrealistic expectations on their children. You want your children to perform in a certain way. Unrealistic expectations of ourselves. Maybe you feel at some point that, I should have been further in life than now. Midlife crisis usually comes from that, where perhaps you compare your contemporaries, and then you begin to think that, maybe I should have done better, or maybe I should have made better decisions. So it can come from within, it can come from without. So basically, anxiety is a disorder of fear. Stress is pressure. And it's important to make that distinction. That pressure can be physical, can be emotional, it can be financial, but it can also be psychological. It can come from inside. It can even come from not necessarily something that is real. And so that's sort of the way to look at it broadly. How does this affect us physically? It does in many ways. And as we go along, you will see there is a bit of a crisscross. There's a lot of similarities in the effects that it has on us generally, on our physical bodies, both anxiety and stress. If you remember, we talked about psychosomatic disorders of the mind, which affect the body. That discussion we've had in full here. These are some of the things that we're talking about, and you'll see a lot of similarities in sort of the presentations. Now, this doesn't present very well, but I'll try and explain it to us. I love this picture because it tells a lot of things about stress. This is the effect of stress on the body. If you can't see it very well, I'll just tell you. There's a picture there of somebody, the brain, and all the different physical organs. So starting from the top, these are the effects of stress. You can have headaches, all right? Stress can cause headaches. It can cause increase in depression, all right? Going down to the heart and the lungs, you can have heartburn, which is caused by stress, rapid breathing. Even the risk of heart attacks is increased by stress. This is now widely known as one huge risk factor for cardiovascular events as well. Even strokes can come from stress. It causes us to have weakened immune system, predisposes us to high blood pressure, stomach pains, low libido, tensing of the muscles, erectile dysfunction, fertility problems. You can have palpitations, rapid beating of the heart, even missed periods. It can mess our periods up. So basically, there's a number of things here that you see that stress can cause, and so it's really important to pay attention to that. All right, now let's look at symptoms of anxiety. I've decided to divide this into the mental part, which is the ones in green, and then the physical parts, which is what the ones on your right-hand side, just for distinction. So in terms of the effects of anxiety on us, on our physical body, you talk about racing thoughts, you're always on the edge, uncontrollable overthinking. One of the hallmarks of anxiety is a constant feeling of foreboding, a constant feeling that something bad or something evil is going to happen to me, a constant feeling that this is not going to work out, a constant feeling that, I'm not good, something will definitely go wrong. Sometimes, most of the time actually, in true anxiety, there's no foundation for it, there's no basis for it, there's no physical evidence to suggest that what you're thinking is actually true. And most people who suffer with anxiety, they will tell us that, I don't even know why I'm thinking that way, but I just do. And, going back to the genetic aspects of it, quite a lot of it can be hereditary, it can run in families, but it can also be as a result of life events. So the way children or the way people have been brought up, things that you've experienced at home, family life, can predispose in us as individuals to having developed in an anxiety disorder. your life experiences. People recover from things in different ways. But we'll come to that in a short while. Going back to the symptoms, the mental symptoms, ability to concentrate, not being able to focus properly, feeling of dread, panic, like I said, irritability and anger outbursts, heightened alertness, always on the edge, worried that something may happen. This is a big one as well, trouble sleeping, all right? Most people who suffer with anxiety tend to tell us about this. Change in appetite, that's another thing, either reduced appetite or overeating. There's also one important one, feeling that you're not connected to your own body. It's as if you're watching things from outside, and always wanting to escape from the situation that you're in. In terms of the physical symptoms, there's sweating, fast breathing. This is also, you find it in stress, racing heart, hot flushes, dry mouth, shaking, hair loss, extreme tiredness or lack of energy, headaches, dizziness, stomach ache. So you can see that quite a few of the symptoms that we experience in our physical bodies are quite similar. And anxiety and stress can go hand in hand. Anxiety can cause stress, stress can then lead to anxiety. And so you find out that they crisscross as you go along. Worthy of note is the fact that, and we'll probably touch on it later on, some true anxiety can actually give you somatic, that physical symptoms that are very, very serious. So people can have pins and needles in their hands. People can have chest pain from anxiety, shaking of the lips, dry mouth. You can have actual symptoms from this. So it's quite severe in people who experience it. Just for clarification's sake, just to make us aware, we will not be able to go into this. What I would personally have loved, being the kind of person that I am, is to have delved into these things one after the other, is to really sort of go into the meat of it. But we won't be able to do that in the short space of time that we will be having this discourse. So in terms of different types of anxiety disorders, just to give us an overview. Number one, the big one is generalized anxiety disorder, all right? The main symptom of generalized anxiety disorder is the fact that the person feels anxious about different activities and events. It's not just one particular area. You find that this anxiety affects all areas of their lives. They're not able to go to work. It affects employment, it affects relationship. And like I said, most mental health practitioners will not make a diagnosis of generalized anxiety disorder until after you've perhaps had symptoms for months, 4 to 6 months, maybe longer. But even after 6 weeks, if your symptoms are persistent or if your symptoms are quite severe, we can then begin to think perhaps this is generalized anxiety disorder. But most people who have generalized anxiety disorder have symptoms for years and years and years. And most of them will not even show up. Most patients will not come up to us. It's usually sometimes when they've had a life event. Unfortunately, I had a patient who, it's really sad, but Caucasian family, the husband decided to walk, to leave the relationship. They were in their 50s and 60s, and children had grown up. And I didn't know them before they broke up, but when she came to me, I then realized that all the while she's actually been masking her anxiety disorder with many things, looking after the children, keeping busy with work, that sort of thing. But once her husband left her, everything became totally exposed. She was just like, it was just like uncovering, Pandora's box. There was another patient of mine who immediately she retired from work. She retired at the age of 55, 56, something like that. She was a healthcare professional. And immediately she retired from work, it's as if everything collapsed, and the anxiety disorder that was there suddenly just went poof, and it came up. So this is the most common form of anxiety disorder. It affects everything about us, and many people have developed ways of masking it or even walking in denial about it and not seeking help. One thing I will say very quickly is that help is available, and most of these things are treatable, even if not easily, but they are treatable. And it is relatively common. Another type of anxiety disorder is panic disorders, people who have frequent panic attacks, no particular trigger, all right? You know, no particular trigger. They have panic attacks, but some things may actually be important to trigger it off. But people who have genuine panic attacks, you see that the fears that they have are not logical, you know? People who can't get on a train because they feel the train will crash, and they begin to have panic attacks. Now, if you look at the statistics, in some cases, you perhaps are more likely to have an accident from a car than from a train, but for some reason they're fixated on a train, and that becomes an issue for them. So it's often very difficult to control, and it's often illogical. Social anxiety disorders, all right? This is, again, something that people tend not to diagnose quickly, because, you know, it's like, oh, I don't want to be around where people are, that sort of thing. But it usually presents as, you know, not being able to speak in groups, not wanting to meet new people, not wanting to date or have relationships. This can be so debilitating that, you know, it has affected, I've seen patients where it has affected their relationships, that affected their lives, that affected their ability to live normally. This is not a case of, you know, I'm going into a new, this is what I was trying to say, that for something to become a disorder, you know, there has to be, it has to be there for a long period of time, and it has to have the ability to actually affect the way we live our lives. So when I started speaking, for example, I had a big fear of public speaking. You wouldn't believe it now, given the amount of public speaking that I do. But I didn't have an anxiety disorder. I just didn't like the idea of, you know, I tell people this and they don't believe me. My friends laugh at me. I love being quiet. I actually enjoy peace and quiet. But by virtue of what I do on many different fronts, I find that but now I relish it. I enjoy public speaking because I find out that it's useful, not just for me, but also for the people that I speak to. So it's not that aspect of just overcoming something. People who have genuine social anxiety disorders, it's crippling, it's debilitating. They can't eat outside, you know, they can't drink in public, and they begin to sweat. They begin to have physical symptoms if you put them in that scenario. So just to say that these disorders can be very, very serious, and you know, it can take over someone's life if it's not properly addressed. Another type of anxiety disorders are phobias, right? Many of us will know of this in friends and family. Oh, and a phobia is worse than a fear. It's an overwhelming fear of a place, an object, a feeling, or even animals. A phobia is deeper than just a fear. It's not just an ordinary fear. It's a deeper feeling, all right? So animals such as spiders, snakes, rodents like rats. Very famously, I believe Will Smith, the famous actor, is afraid of rats, and a few other people who have phobias like that. He will literally jump and start running when he sees a rat, or even move out of the house if he thinks there might be a rat in that house. Coming from the Nigerian background where I am, we learn to live with rats, but that's a different story entirely. Environmental factors such as heights. Some people have a fear of heights. Some people have a fear of germs. You see people always washing, cleaning, always, you know, doing all of that. It's a phobia. It's a form of phobia. And again, a lot of these disorders come in varying degrees. Some people have really mild forms. Some people have really, really, really tough ones. And I'll mention that again when we come to obsessive compulsive disorders. There might be even phobias in terms of being blood, you know, people not being able to see blood, people fainting or collapsing when you know, at the sight of blood and things like that. So it's that one type of phobia worth mentioning is agoraphobia, you know, the fear of being in a difficult situation where escape might be difficult. Why am I mentioning it? Because most people who suffer with agoraphobia, they can't leave their homes, they can't get on a bus, they struggle in crowded places, and it literally affects the way they can live their lives. Other forms of anxiety disorders, obsessive compulsive disorders, or OCDs. I had a patient, a young lady, 25-year-old Caucasian lady, who she had OCD so bad that when she had children, she couldn't nurse her children because she felt that they were dirty. Now, it may sound strange to some of you, but that's how obsessive compulsive disorders work. She washed her hands until her skin started peeling off. She would literally wash and clean her hands until her skin starts to peel off. That's how bad OCD can be. Like I said, most of these disorders come in varying degrees and severities. So some people have mild OCD, but in the very severe forms, she literally could not nurse her own child. We had to get social workers and things and parents, grandparents involved in helping her to nurse her child, because she just believed that, you know, the skin of the child was dirty and things like that. It's sad, really, but it happens, and that's what we're here for, to help with things like that. So other forms of anxiety disorders, skin picking, hair pulling, you know, lots of different things. Now, I like to always point this out, that not everything that presents this way is a mental health problem. So just to give you a quick snippet, there are things that look like mental health, behave like mental health, but they're not mental health. So for example, thyroid diseases can give you fast beating of the heart, can give you dry skin, it can make you feel tired, and you might feel, oh, maybe I'm stressed, maybe it's this, but actually you have an underactive thyroid. And so it's always important to get these things checked out. A routine blood test from your GP. As a matter of fact, when we teach medical students, if you are dealing with depression, for example, just for a quick example, we always encourage our students to do a routine blood test. You know, do a routine blood test. Check their iron levels. Check their vitamin D levels. Make sure that there's no organic or physical cause to the symptom before you now start thinking this might be actually depression. So we need to be aware as a community that sometimes when you're experiencing these things, it may not be that you actually have stress or anxiety. There may be an underlying problem there, and it's worth ruling that out first. But drug side effects can give you similar symptoms. Excessive alcohol, of course, recreational drugs, SLE, lupus can cause similar symptoms. All right, now I want to jump quickly into, because I know I've said a lot, where we're saying a lot in a short space of time, but I also want to give room for questions if possible, and for people to sort of participate if there are areas where we want to emphasize a bit more on, or if people have questions or contributions even. So one of the things that I find to be quite helpful is stress prevention or cure. And I call it prevention because sometimes it's better to try to prevent stress rather than allowing stress to happen. And I'll explain myself. Stress can be difficult to deal with. By the time you're dealing with stress, it's already beginning to tell on your body and on your physicality and on your mind. It really, really can affect us in many different ways. For those of us of faith, it can affect even the way you negotiate your faith. And so it's really important that these things are nipped in the bud. These things, we look after ourselves. This is why I liked the session last week about, healthy living and things like that. I'm sure you've heard a lot about what I'm going to be saying now. But one of the things that helps to prevent stress is having a good night's sleep. And a good night's sleep is different for many different people. The thing growing up, I heard is 8 hours of sleep. Now I know for a fact that, speaking to sleep physicians, that even 4 hours sleep, as long as it's quality sleep, as long as you have had quality sleep. I know people, and I'm one of them. I can't sleep for more than 6 hours at the most. But I feel refreshed and I'm absolutely fine. I function very well on 5 hours of sleep. I have a colleague that if she doesn't sleep at 9 or 10 hours, don't even talk to her. So good sleep is going to be different to different people, but make sure we are getting sleep. Now, the way the body is wired, there's something called the biologic clock. God, or if you don't believe in God, our bodies are made in such a way that we are meant to rest at a certain time. The biologic clock begins to shut down in anticipation for sleep. This is why people who are in, people in the military, they use sleep deprivation. They use sleep deprivation as a way of torture.
Yeah, if it hasn't gone through.
People use sleep deprivation as a way of torture. The reason being that if we don't sleep, it affects the way you are able to function. It affects the way you can function. And a lot of mental health triggers, people who get triggered into mental health problems, many of them stem from not having good sleep. And so a lot of the treatment will be initially just getting people to actually rest the brain, get them to, and I can't emphasize this enough, because we sometimes live in a society where we overlook things like this, but it's little things like that, getting proper rest and sleep. All right. We'll talk about that more if more questions come in. Of course, a healthy diet, exercise, very important. I'm sure this is talked about last week. Really, really important to mind what we eat and how we eat it and when we eat it, etc. Work-life balance. Now, this is a biggie, especially for stress. It's so important that you have times when you work hard, but times when you also rest or play hard. And that's really important. I had to learn the hard way. I mean, many years now. There was a time when I went 7 or 8 years without a holiday. And I'm not even making that up. 7, 8 years, no holiday. I just want, every holiday was an opportunity to do something else. But I quickly learned when I turned 40 a few years ago that, you have to look after this body so that it can look after you. So a good, healthy work balance is good, even while you're working. When your downtime needs to be absolutely down. Some people, I had a GP over, we had my children's, one of my children's was celebrating a birthday, and I had some colleagues over at GP, and he came with his work laptop. This is my kid's party. And I said to him, "What are you doing?" He said, "Oh, he's just catching up on some letters and things like that." and I shook my head. Obviously, he's a colleague and a friend. But I later on said to him, "Mate, you're not helping yourself. You have to," and whether it's a good or bad thing, some people may look at it as a bad thing. But this is what I would advocate. When you leave work completely. Leave work completely. There will never be an end to work. And this is me coming from somebody who manages a team of 35 people as well. There will never be an end to work. They have to make that clear distinction. If you're carrying work home, if you're working where you're not supposed to be working, or if you feel that you can cheat, well, I use the word cheat very lightly, by trying to do, all of us will check work things and all of that, but there has to be a clear distinction between work and when you're not working. Otherwise, it catches up with you, and that's what causes burnout. Because after a while, you burn out. Take your holidays, make use of it. Even if you don't go anywhere exotic, get a book, read a book, do something. I don't know about you, but I'm rediscovering the love of books, even if they're audio books. I found out that it helps me to chill. It helps me to really, really expand my horizon. I'm a big I love learning about different things, different cultures. There was a book, okay, let me stress some of you out. There's a book I read about the origin of names. All right. I mean, somebody's like, what? Yeah, the origin of names, Scottish names, Welsh names, African names. And I found out that MacArthur simply means son of Arthur. It's MacDonald means son of Donald. Now, it may not mean anything to any of you, but it's good distraction from all the busy things that I do. I'm just chipping that in. All right. Stress prevention, good human relationships, not holding on to grudges, etc. One of the things I say to people who work in toxic environments is there are many different ways of dealing with toxicity. You can modify the environment in such a way that the toxicity is no longer there, or you may find out that you have to extricate yourself from that environment. But living or staying in a toxic environment is not helpful to you. One of the things I failed to mention when we talk about stress is the longer you remain in a condition of chronic stress, the more difficult it is to come out of it. The longer you remain in a place where stress is continually piled up on you, the more difficult it is for us as healthcare professionals, and even for you to come out of it. So people who have suffered a lot of long-term stress, it also takes a while. Like many counselors will tell you, they need many sessions. They need multiple appointments to be able to really, really begin to help them get away from that situation. Having a positive mental attitude, self-image. See, this is a whole talk on its own, where your identity begins to determine or helps you to be able to cope better with the issues that life throws at you. For example, I have no problem identifying as being a Black man. That's who I am. Or call it a chocolate, brown, whatever you want to call it. I have no issues saying that I'm Nigerian. I tell people I'm Nigerian. Yes, I do hold a British passport, but I have no problem identifying as being African. Now, there are people who, for this little bit of information is a stress factor, either because they may be mixed race, quarter race, or there's just some identity problem. My parents are Jamaican, but I was born here. So am I Jamaican or am I, British? Having a positive self-image, self-worth goes a long way to be able to help tackle or deal with things that can cause stress and anxiety. Developing a positive mindset, especially with this COVID pandemic. A lot of people interestingly, texted me, called me at the beginning of the year, what's going to happen? What's going to happen? What's going to happen? Are you not worried about Omicron? And all? I said, no. And people are like, why are you not worried? I'm like, how is worrying going to help this situation? Oh, you make a good point there. Yeah, whether you worry or not, there's going to be another variant other than Omicron. I'm not saying that somebody's told me anything, but these are the way viruses behave. We had Delta, we had the South African one or the Nigerian one. Now we have Omicron. I'm not worried. Instead, I'm actually thinking, how do we deal with it, or how do we cope with it? How do we, if you like, thrive in these difficult situations? So having a relaxed mental attitude goes a long way. And people who are practitioners or counselors, they will tell you more about how we can develop that. Resilience as well is the capacity to recover quickly from tough or difficult situations. This is one of the classes I teach my teenagers. I do a youth mentoring thing in the community mainly for boys, but for children rather, from single parent homes. But because I find out that situations that are troublesome will come. There will always be an unpleasant situation. That is a given. So that's not the issue. The issue is, how do we deal with that? How do you prepare yourself to deal with things that are not pleasant? If you think, or if we think that life is always going to be hunky-dory, everything's going to be fine, then things will catch you by surprise, they will catch you unawares, and they will knock the wind out of your sails. However, if you understand that there will always be something, there's always going to be a problem, there's always going to be an issue. Forgive my French, but some idiot is always going to talk to you bad at work or at the filling station. Something is bound to happen. If you come prepared with that, then I find that we're able to deal better with situations. So like I mentioned at the beginning, part of the thing that causes stress is having an unrealistic expectations. People are not always going to be kind to you. Your father lied to you. You're not a princess. Somebody's going to somebody's going to say something to you. Somebody's going to do something. So the issue is, how do you cope with it? How do you prepare your mind? I hope I'm sort of making sense. We'll come back to the questions. Now, in terms of anxiety, my time is nearly up. I love this because I'm kind of like one of those that I'm an eternal optimist. I always believe that we can help people. I always believe there's a way. I always believe that we can help somehow. So in terms of managing anxiety, we talked about dealing with or preventing or helping with stress. Self-guide, self-help is very, very important. So we put people in psychoeducational groups where people who have suffered similar things, like the AA and all these other people, Alcoholics Anonymous, we put people in groups and we talk about it. Sometimes talking about a problem, sometimes discussing it can be very helpful. Self-guided self-help where somebody, a practitioner, takes you all through all of that can also be helpful. Talking therapies are also extremely useful. As a matter of fact, in the last few years, this has been the mainstay of treatment of managing anxiety disorders in particular. Cognitive behavior therapy. Cognitive behavior therapy helps us to challenge our negativity. Why are we thinking the way we are thinking? And then it gives us coping strategies. Applied relaxation is another one. Exposure and response prevention. Of course, medications, and there's a whole raft of them. The main pick of the bunch is the serotonin uptake inhibitors, SSRIs. So your fluoxetine, your Prozac, etc. Beta blockers have come to their fore in recent times, because if you have palpitations or fast beating of the heart, or you're excessively anxious, this can help. This also helps with stress because beta blockers have been found to have a calming effect. Beta blockers were originally designed as blood pressure tablets, interestingly. And so they're quite safe to use in pregnancy and all of that as well, which is a massive plus for us when we struggle with finding medication to help people who are anxious and they may be pregnant or trying to get pregnant. The other types of drugs, benzodiazepines, diazepam, lorazepam, etc. Your doctors and people will tell you more about that. But medication is important. Medication is an adjunct. Research has showed in recent times that it's a combination of both talking therapies or things like that and medication, you get the maximum result. Talking therapies on their own are good. Medication on their own are good. By the time you combine both, you get better results. And so that's really important. This is particularly important for the Afro-Caribbean community where there's a lot of stigma behind using medication. Some people have said, am I going to get addicted to it? And I always say to people that as your doctor, would I give you something that will be harmful to you? The only thing that might be addictive here is benzodiazepines, such as diazepam, and that's why we don't use it very often. Well, your average antidepressant, anti-anxiety medication, you can't get addicted to it, just in case somebody wants to ask the question later. Beta blockers, you don't get addicted to it. So it's great to use, and normally we use it between 3 to 6 months or up to 2 years, but I've had patients who have been on them for many years. Something that has come to the fore in recent times are complementary therapies. So mindfulness, yoga, hypnotherapy. These are relatively new areas in the medical field, but they're beginning to gain footing. Now, it's not widely available or even approved by most NHS providers, so you may not be able to get mindfulness on the NHS or yoga or hypnotherapy, but there's a lot of evidence coming up now that it can be useful for certain types of individuals. All right, so I'm going to stop there, and I hope I haven't confused you further. Thank you, and I'm seeing that there's a lot of hands and questions going up. Please put your questions in the chat. We'll try and get through them as much as we can. Ngozi, are you happy to moderate, or should I just pick the questions?
Yeah, you can. I can moderate for you. I can ask some of the questions. I'll try and group them so that you can just concentrate on providing the answers. As you can see, as we thought it would be, there's been a lot of interest and there's lots of questions, some of them private to me. And I think just to ensure that we can get through all the questions, I can see there's a few hands up. It would be really helpful if you can put the questions in the chat because it does make us a bit more efficient. Thank you. So one is, there's a question here about managing stress with the threat of losing jobs in terms of vaccination. So that's a question that I suppose deals with the issue of anxiety and stress with the prevailing conditions we're living under, the fact that there's COVID as well. So it might be helpful to address that one because that's quite a big one.
Yeah, thanks, Ngozi. It's a difficult one to address because this is something now that's being proposed and driven by the government. And I think like you, like myself, I've expressed to you in private that I don't particularly agree with that approach of trying to make health professionals take the vaccine or lose their jobs. I don't think it is fair. I don't think that's the best way. I feel education and sort of helping people to understand better is still the best approach in terms of helping people to understand. I'm a big advocate of the vaccine. I talk about the vaccine all the time. I could talk about the vaccines in my sleep. I believe they're important. They're not foolproof, but they are important. But I still don't think that people should be penalized for their belief. That's what I think. In terms of being able to manage that, I think there's still room for a lot of negotiation. It's still in April. I've been on BBC radio a few times, once or twice, talking about it. I've been asked this question, and I've, in my own little way, I've tried to send a message to the government that I don't think this is a good idea. We're piling more pressure on an already pressured system. And I think there's no simple answer to this because it's a systemic issue. If the system is changed or if the rules are changed to that, then it has to be dealt with politically. In terms of how we can cope with that, I think it's really important to apply some of the principles that I talked here. Have a relaxed mental attitude and a positive attitude. Worst case scenario, is that this will be fought in Parliament. This is what I think personally, and also I feel that there will be some kind of concession at the end of the day. I don't know what you think, Ngozi, but I think that if we start losing a lot of staff and a lot of people, there may be a U-turn where some of these things may be changed. But there's no simple answer to that. So,
yeah, I think it is a concern. But as you've said, that's the rules now, and coming to things like this and making sure that you access good sources of advice as well, because the first thing is to address why you might not want to avail yourself of the vaccine, and then the second thing is the stresses around it. But if the advice remains the same, then we need to be able to signpost people where they can get up-to-date advice and how they can help to manage some of the stress that might come from anybody losing their job for any reason at all.
Yeah, and I think, let me piggyback on that. I think that's a really good idea, because this is what I'm saying, that why we should also be looking at why do people not still want to take the vaccine? You know, why are we still reluctant? And do we need more education? Do we need more? I have been involved through CAHN and Charles. I've spoken to a group of social workers. I've been invited to some other little groups here and there where we try to talk to people and explain to them that, look, at some point, you know, we'll have to think about patient safety. And because the NHS is your employer, they do have a right to say that this is how employers should behave. And so that needs also looking at as to why people are not wanting to take the vaccine. In terms of dealing with the stress of that, it's going to be really difficult. Some of you may or may not follow basketball. There's a very famous basketballer called Kyrie Irving. Kyrie Irving is a fantastic, talented guy. He earns $80 million per year. At the moment, Kyrie Irving has not been able to play basketball because he has refused to be vaccinated. So it's estimated that over the course of 1 year, he's going to lose almost $40 million. That is how strict, this is America, this is how strict other people are looking at how, you know, to sort of safeguard people. Because the truth of the matter is, vulnerable people are dying from catching COVID. People are falling ill, effects of long COVID, etc. So I believe that the government has a right. I think they have a point in terms of encouraging people to still go ahead and take the vaccine. So really, like Ngozi, you are saying, I think we should also ask people, why are we not wanting to take the vaccine in the first place, and what can we do to convince you further?
Okay, thank you. And there's a question here about the deadlines. So that there's lots of information online about the deadlines, but you should access your HR support within your individual organizations. Yeah. I think the February date is because it's thought that that's the latest date that you can have the first one.
Yeah, before April comes up.
So that you can have the second one as well. So I'm going to address some of the questions that have come through about anxiety and depression itself. And one of the questions that I've got is if you can talk about the benefits of encouraging people who are feeling anxious about being able to make good decisions for themselves. I like lots of the examples you provided when you talked. You know, the one about holidays really resonated with me because I remember watching friends of ours were all watching TV, and they'd have prizes up of either to win a refrigerator or to win a holiday, and they'd have to pick which one. And people would say, oh, wow, well, why would they pick a holiday? A holiday is gone. You know, you can have your fridge for a lifetime. But in actual fact, it's really, really important to have downtime.
Yeah.
And it's become more difficult to do that with working from home, where the boundaries between work and life can be very blurred. So I think we need to try and have the same discipline of having a break from work to give you that work-life balance, because all that adds to the stress.
Yeah, absolutely. Especially with us, you know, in the Afro-Caribbean community, where we many times we are in frontline jobs. Many times we are in essential roles, be it the postman or whatever it is. Many times, not everybody is well paid, and you're thinking about how much money you can make to send back home to Jamaica or to the family in Barbados, or, to the family in Congo. And what I say to people is that you have to look after yourself so that you can continue to do that. Otherwise, it will be difficult for us to be able to continue to function. So yes, I totally agree with you. It's one thing that we have to learn and sort of grow into. In terms of advice to somebody into making good decisions when they suffer with anxiety, here is the problem. People who suffer with anxiety, they are not able to see the wood for the trees. They struggle to make good decisions because the anxiety disorder is giving them a false bit of information. They're acting based on a fear that is unrealistic. So whoever is asking that question, you and I, and myself inclusive, are going to struggle to convince that person to make a good decision. This is why we encourage people who have anxiety, or when they're diagnosed with anxiety, to go and get therapy, to get medication. One of the things that SSRIs do is they block the pathways. Serotonin is kind of like a feel-good hormone. It helps you feel better about yourself. So what the SSRIs do is block the pathways of reuptake. So it makes more serotonin available to you so that you feel better about yourself. When you feel better about yourself, you're going to feel less anxious, you're going to feel less stressed. That's simply how it works in very simple layman's terms. So people come and tell me, oh, why is it that every doctor, they just want to give us tablets and all of that? One of the things we signed up to as health professionals is, first of all, to do no harm. So we want to help you get better in the first instance. So when we find out that, so people who are, just to answer that question, if people who are suffering with anxiety, if you like, are going to be very difficult to reason with. You're going to struggle to make a good argument with them because a lot of the phobias and a lot of the fears that they have are not founded on anything logical. Until that begins to change, which is why I talked again about CBT and talking therapies, where the therapists will begin to help us challenge those paradigms, the way we think. Then you combine that with medication. Then you begin to see. I'll give you a quick example. There's a young lady.
Can I just ask though, before you give the example, is that although you say it's not found anything, isn't it your reaction to? So it could be that two people are faced with losing their job. And one is quite practical about it, thinking that, well, you know what, I need to go and reskill. I need to open the field a bit wider and think of how I'm going to get another job. While the other person, when that's combined with the stress of having maybe a partner who's not supportive, with having 3 children and you're thinking about how I'm going to feed them, just becomes paralyzed by that stress. And so they respond differently. So whilst you might have a different reaction to it, and one of them is helpful and one of them is unhelpful, it's not an unfounded fear. It's not unfounded in that sense. There are things that are getting to them that are making them feel anxious and upset.
Yes, so this is why we try to make the distinction. Yes, you're absolutely right. This is why we try to make the distinction, first of all, between stress and anxiety, and also in the fact that these symptoms can be in varying severity. Some people have mild symptoms, some people have so in the extreme forms of anxiety, there's nothing there that's causing the anxiety. There's nothing you can put your finger on. Or
maybe there was something there, but that's been compounded. And
exactly.
Say, look,
so
worrying about it, we always say worrying will not help.
Exactly. So, but in terms of the example that you gave, again, all the coping mechanisms that we talked about, in terms of having resilience, having a positive mental attitude, making sure that we look after our health, will all contribute to making that, helpful. And that's one way of going about that.
Yeah, and friends and family, because I know that there are times when I just feel a bit either the workload or whatever, and I have my go-to pick-me-up friends that I know and family that I know if I call them, well, after the call, I'm going to feel great.
It's one of the things that I actually, after I did my slides, it was in a former slide and I didn't put it on. Isolation is a huge bit of thing that contributes to stress and anxiety. So it's actually one of the things that we use to cure stress and anxiety. So we encourage people to get friends and family around them, have some sort of support group, church, mosque, in a local hub where we are in Rochdale, we started encouraging people to join the local mosque groups, because we found out that all the research points out that people who go to the church or to the mosque are less likely to suffer the severe effects. Why? That whole social hug that you get from being around people contributes to reducing your symptoms. So you're absolutely spot on. So in terms of also, just to point out that risk factors for people who are going to have real adverse effects from stress and anxiety is, number one, if you're single. If you don't have a relationship, or you're not married, if you're male, it's more likely to hit them harder. While women suffer more, males suffer harder. So you have more people suffering with stress and anxiety who are female, but people who have adverse effects are most likely to be male. Unemployed. If you're unemployed, if you don't have a job, if you don't have something to go to, if you don't have something you're doing, you're more likely to suffer the adverse effects. So all these things, when you go to a job, one way or the other, you will interact with people. I know, fine, these days we're talking about work from home and all of that, but generally, so those are the things that really help. So thank you for bringing that up, Ngozi. That's really useful.
There's a question here about, someone's asked, is it possible to relate negative disorders to lots of the different microaggressions that people may experience for a range of reasons? So it's sort of, all these things are compounding, and it creeps up on you. So you might say, well, all they said was X, but in actual fact, it's not just that X. This is the culmination of constantly being undermined. So thanks very much for that question, James Murphy. Constantly being undermined, and then it builds up to a big event. Is that possible? So that when you're now going for your talking therapy, and you might not even realize it, but you've sort of been able to cope and cope and cope until the sentinel event happens, and you just think, I've had it.
Yeah, no, that's a brilliant question, and it's a brilliant point that's been raised. Like I alluded to very briefly in my talk. So racial discrimination, for example, there was a brilliant paper written, I think it came from the US or somewhere, about the fact that chronic marginalization, chronic racism placed a huge part in how people develop stress later on, and even went on to develop hypertension and cardiovascular problems. So absolutely 100%. That constant, it's like a drip, 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 drip that eventually then opens up, a big pathway of a flood. Definitely contributes. This is one of the reasons why one of my roles that I play is very recently, is in helping to talk about inequalities, in health inequalities and racial inequalities within our own sphere, because all those micro events, by the time they get added up and over time, contributes serious health risk, which even become physical risks, like in high blood pressure or heart attacks. So yes, that's a brilliant point.
Yeah. There's another, someone made a comment that they support colleagues who have anxiety, and sometimes they start off by asking, after they've had the session, what makes you happy? And some people struggle with that. And I think that's a good thing for people who are having anxiety and stress to think about what would make them happy. So and sometimes it's not, you might think, well, it's very binary. So if I'm anxious because I don't have a job, what might make me happy is to get a job. But I remember reading recently something about internalizing, because you know how you meet some people that are constantly on the up? And it's, so I think that's sort of protective, because it might be that you get a job that, in actual fact, that is not the answer to all your problems and the way you feel. So sometimes it's about looking within.
Yeah, no, I agree. I mean, I think that's a really good contribution from Vanessa, because when someone was asked at a marriage counseling session, are you in touch with your feelings? Said yes. So describe to me the range of feelings you had in the last 1 week. And the guy goes to say, I was tired and all of that, but that's not a feeling. So many times we are not able to really pinpoint things. And this is something, again, that is quite common in the Afro-Caribbean community. We struggle to actually identify what's happening in our life. We need to be more in touch with our emotions and not feel ashamed about it. I was afraid. It's a legitimate thing. I actually tell my children that there are certain things that I'm afraid of. That is Daddy is big and bad, but daddy gets afraid sometimes. Daddy gets worried when you run around on ice because you might break something. You know, daddy is worried about you when you go on school trips because I don't know what kind of food they're going to give you. I let them know that I too have these kind of emotions and angst, so that when they have anxieties, they can come and tell me and we can resolve it in an amicable way. It's a false economy when we are brought up with this bravado about not being able to say, you know, the things that we really, I was angry. I didn't feel good about it. You know, this happened. Someone's had a relationship break and they go, everything's fine. I'm okay. This and that, you know, and all of that. It's okay for you not to be okay sometimes. And sometimes we really need to come to terms with that, because part of the pathway to healing is to identify that actually, I'm not okay. Things are not going very well in this area. Many people, especially in the Afro-Caribbean community, are in denial about how they really feel. Your daughter has not had a child. She's been married for 5 years. It's worrying you, but you're not willing to own up to the fact that this is a major issue. And so it eats you on the inside, causes stress and anxiety. You develop high blood pressure from that. Totally preventable. I would love to talk more about that, but I shall not be tempted. There's a few questions popping up.
So there's some questions here that people have anxiety due to trust issues and being abused, and what advice can we offer? And I know that the Caribbean African Health Network has a helpline, and we will give that out today.
Yeah. We have a helpline, and we have a whole counseling unit that can help with that. This trust issues is a typical example of post-traumatic stress disorder. Someone's done something to you in the past, or done some things to you in the past, and now you struggle with either relationships or with stress. It's a form of post-traumatic stress disorder. Very real, it happens. What you need is to speak to a healthcare professional. In CAHN, we have a counseling unit, trained counselors who will guide you through it. I must say that this is totally free. The funding is provided by external people, but to you, that service is totally free. Please get in touch. The flyer has been displayed there. Those people who are suffering with this need to go through counseling support, and may even require further intervention. So that's a good way to go about that.
I'm hoping that with this, if there are people here listening today that do have are suffering with anxiety or depression, that they reach out, because you've talked about the risk factors, and being by yourself and trying to manage this and trying to say, I'm going to pull myself together, sometimes is not enough, and you need to seek help. So even if it's one person here today who is able to reach out to our counsellors or go to their GP that we can get through to, I think that'll be great. Because sometimes, and it's not, you know, whilst we're in control of a lot of things, sometimes you cannot control this. This is not a fault thing. It's just how you feel, and there is help. And I think the fact that people don't always see this as a condition that you can ameliorate means that you're more likely not to share. Yeah,
absolutely, 110%.
Yeah, and someone's written that is it denial about feelings, or is it having the vocabulary to articulate those often tacit feelings? I think it's both, because I've come across people who, even when you might, you know, sometimes I've seen or I've heard where people will say, look, I'm not feeling good today, I'm feeling a bit down. It's okay to feel down, and then, you know, you go to your friends and they pull you up. But if it's constant, and some of the examples that you gave, some of it is that you feel that you don't want to share those, because the way issues about our psychological health have been managed in the past is that there's an element of either blame or something that you can do about this, that there is some self, that you should be able to manage this yourself. That's what people
pull yourself
say.
Up by yourself.
Pull yourselves together. Everybody's heard that. But sometimes it's not enough. So I think that's part of the denial. I think our men, unfortunately, are more likely to feel that they need to be the strong type and might not go and seek help. And I think people who are used to dealing with this are used to dealing with such a wide range of people that even if you don't feel you're articulate enough to express your feelings, they can help you.
Yeah.
They can help.
No, I couldn't agree more. Just to quickly say that I agree with you. I think it's both. But also one of the benefits where we get when you go into counseling or when you speak to a counselor is that what I have found over the last many years is that counselors help you to articulate. They help you to bring out those things. You may not necessarily have the vocabulary, but by the time they begin to pinpoint those things, you'll be like, yeah, that's how a lot of my patients come that. And this cuts across the board, Afro-Caribbeans, everybody. By the time we start talking, they're now able to actually see that, oh, that's the way I was feeling. I couldn't give it a name. I didn't know how to name it. I didn't have the right vocabulary for it. I didn't know what to say, but now that you've mentioned it, this is another benefit. And this is one of the things that I will emphasize again, that there's this, reticence, there's this reluctance to go and speak to someone for various reasons, either because we are male and we're macho, or we're Afro-Caribbeans, or we're faith people and we feel that, it's a sign of weakness to go and speak to someone about it. It's really, really important. There's a whole raft of development now in faith circles where we've got Christian counselors and Muslim counselors and people like that coming up to say, look, I'm a Muslim, but I'm a counselor, and this really helps. So that's a good point to do.
The other thing I'd like to say is that I've had a private message about our own, in the community, our listening skills. Because there are times that a friend will call me and say, we'll be chatting, she'll say, are you okay? She's checked in because my mood seems a bit low. I'm not as effusive as I can be. And just that check, are you okay? And sometimes say, well, actually, I'm not feeling too good today. And that leads to a conversation. So use those listening skills with your friends and your family. Have a check. Are you okay?
Yeah, absolutely. I think Kasim wants to ask a question and doesn't know how to go about it. He wants to be given a chance to speak.
Okay, I don't have access to the.
Let me unmute you, Kasim. You have 1 minute, Kasim, to ask your question. I'm going to unmute you in a second. Go for it, Kasim.
All right, thanks, Doctor. How are you today? Okay, yeah.
I'm very good.
Yeah, my question was about, you said about the lady who had problems with her hands, OCD. Yes. And she had a lot of problems with the children and things like that. So how was it like, there was no another alternative way apart from the social services who came and helped her? And the thing is, if she had a lot of stress, why was it the social worker had to come and help her? Because that was another stress again towards her.
Very good question, Kasim. Thank you very much.
Yeah.
So here's the thing. It wasn't just the social services. First of all, we operate in a system where we are obliged to live by the law. So if a child, and Ngozi will tell you more about this, if a child or a vulnerable person is deemed to be at risk, we are obliged to get social services in. Social services is not always a negative input. If it may look like it in the news and all of that, but in fact, this particular lady, because social services got involved, she got a lot of help. She had, but also her family got involved. Grandparents got involved. Unfortunately, she didn't have a supportive partner, which was part of the stress that she had. But social services ensured that she got benefits, she got bus passes, she got appointments and if she needed to go for an appointment, it was all paid for. The input of social services actually helped the situation a lot. So if done properly, social services is not always a negative thing, but we have to in many cases, involve social services so that that child who cannot defend themselves can have some sort of defense. I don't know if you want to add to that, Ngozi.
No, that's a really good point, which you've summarized excellently. I think just like mental health issues, social services have had really negative connotation. And I'm sure that if there are anybody here on the call today working in social services would want to add to what you've said and to support what you've said as well, because there are lots of things that they can help you with. Yeah. I don't think that majority of people know some of the things that you are actually entitled to. I remember when my children started school, there were lots of things that I felt I wasn't entitled to. And I was surprised when I got a list through of the things that I was entitled to for my children. I just presumed that because I work, I'm not entitled to anything, but there were lots of things I was. So it's important that if you are struggling, you ask for help. And social services, that's what they're there. They're a social service. You know, there are things that might not be directly medically connected, but when everything gets too much, they're there to ensure that you get help. So that's the way to think about it. That's the way to think about it. Someone said that they went to see a doctor and to speak about their worries, and the doctor wrote in front of her that she was psychotic because she said a voice told her to pull herself together. That's not unfortunate. Unfortunately, there will always be the people who are you go to for help, and unfortunately either haven't been trained in the right way. I would think that, Corinne, that hopefully this is a one-off, and you can always ask to see somebody else if you feel that you're not getting the support that you should.
No, let me just quickly add to that, you know, one of the reasons why I got involved with mental health at the very early stages of my career was just things like this, where I saw a lot of people who may or may not have had mental health, may or may not be from the Black ethnic minority group, who are not being listened to and not being well attended to. So there's a bit of a training issue there, because you do need to have some sort of training to understand mental health issues. Not every GP is trained to do, but most of us will, even if we don't have the training, we'll know where to signpost you to. But unfortunately, this is a rather unfortunate incident, like Ngozi said. Okay.
So thanks very much for all your questions. There were some COVID-related questions, and we are planning a COVID session in the next couple of weeks. I think either the last week of January or the first week of December, because we know there'll be questions, especially for people who work in healthcare, who are either, even if you've had your vaccine yourself, you'll probably have colleagues or friends who are really worried about being forced to have their vaccination or lose their job. So we're going to try and run a session just to talk about variants. I don't think the Omicron variant is the last variant we'll have seen. Because of the virus, and what viruses do is try and ensure that they keep themselves going. So they will, there'll be different variants, and you know, we don't really, that's the way it is. So we're planning a session to talk about vaccines, about all the concerns that people have raised, that, well, I've had my vaccines, I've still had it. The number of people in hospital, and all those issues. So we'll let you know in good time so that you can either send us your questions by email, or you can be here to put the questions in the chat if you don't have access to the chat facilities, because we do find that it works much better. Because, you know, interestingly, what I find is that although we're all from a wide range of backgrounds, we all have the same concerns and worries. So when I see the questions coming through, lots of people have the same issues. So that's why it's much more efficient if you can send us the questions and we can ask them all together. But Joel, thank you once again.
Hey, my pleasure. Always happy to be here.
Yeah, really interesting session. Thank you. I'm just going to hand over to
Ngozi, just before you go, hello?
Hello.
Just before you go, mine is a question. I just want to say thanks to the CAHN team, the chair, chief officer, the doctors, consultants, and all the workers that work in CAHN. I believe it's a great blessing that the Lord has given to us, these people, and it helped me so much. And I just want to say Happy New Year to all of the CAHN team and everybody who works with CAHN. God bless you all. Bye-bye.
Oh, thank you. That's really nice of you. I don't know who it is. Who's that?
Oh, it's Faye's mom.
Okay.
Oh, Mrs. Rudock.
Well, thank you. Thank you for your comments. It's really nice to get positive feedback. And the other thing that we're going to be doing in the future is that we really need to make sure we evaluate how much the impact this is having for people who are listening. So we're going to find a way to collect some of that feedback. So this is the first one. I wish we were collecting it today, but anyway, thank you so much, Joe. And I'll hand over the CAHN team.
Thank you so much for that, Dr. Ngozi, and thank you so much for that, Dr. Joseph. It's really lovely to see everyone this week. Happy New Year, like Mrs. Ruddock has rightfully mentioned. It's a new year, there's so much in store, and we just want to say thank you for everyone that's been tuning in since the beginning of the pandemic, May 2020 up until now. So thank you so much. Thank you so much again, Dr. Joseph. We've loved having you this morning for educating us around that anxiety and stress. Thank you again, Dr. Ngozi. Week after week, the both of you and all of our other doctors giving out of their free time to educate us and answer questions.
Thank you. Thank you
so much for that.
Thank you so much too.
Thank you so much for those that are tuning in on Facebook and YouTube. Thank you for those as well, and for those on Zoom. We just wanted to let you know all of our health hour sessions week after week, we stream to YouTube and Facebook, so you can always go back and watch those sessions as a resource as well. I just want to let you know for some of our upcoming events, so if you want to take note of this as well. For the next week, our health hour will be focused on Black skin and disparities. So that's on the 22nd of January. And then on the last week of January, we're going to be focusing, like Dr. Ngozi rightfully mentioned, we're going to be focused on managing COVID-19 and long COVID as well. And some of our flagship events as well that you can also expect. We have our International Women's Day event coming up, and that will be on the 8th of March this year. And we're back again with our Windrush event. That will be again this year in June, the 25th of June. And then we have our Black History Month event that will be on the 29th of September as well. And then our annual gala as well on the 22nd of October. So many events coming up. For those as well that had questions around family and advocacy, we also have our family and advocacy service. So feel free to contact our community engagement team at communityengagement@CAHN.org.uk, or you can alternatively contact us at help@CAHN. If you have any questions throughout the week, our helpline is always available. So we're always on standby for people in the community that need to seek help from us, and we're always here to support, so feel free to do contact us as well. Thank you again, and we look forward to seeing everyone at some of our upcoming events. If you have any questions throughout the week, please do get in touch with us. We also have our Healthy Hearts as well. That's again on Tuesdays from 5:30 till 7:30 as well. So that's again, like Dr. Joseph rightfully mentioned, again looking after our health, self-care. So that's looking at more around our diet throughout the week, followed by some physical activity. So yeah, it's good to see everyone back. Please do share these links, invite friends, invite colleagues, invite friends and family as well that can find these sessions very useful. Please, it's very important. Let's try to spread far and wide across the world, really. But yeah, we've loved having everyone around. It's good to see some familiar faces, Auntie Elaine, Mrs. Ruddock, you know, so many familiar faces. It's good to see you, and we look forward to seeing you all next week. Have a lovely weekend. Bye.
CAHN Health Hour. Get informed today to have a better, healthy tomorrow.